Hello, good evening. Dr. Chudi Ufundu over here. Today is our clinic in YouTube, open clinic with Dr. Chudi on YouTube. Today's topic is one of those very impossible to believe stories in medical practice. It's actually a very rare phenomenon. So today we're going to talk about superfetation. Superfetation. Thank you so much, Kenneth, for joining. So in this phenomenon, it will surprise you. Normally we've taught you guys about the process of pregnancy, what happens in pregnancy, and the changes expected in pregnancy. But what we're going to talk about today, it's actually an odd phenomenon, very, very rare. So imagine a situation where a woman is confirmed pregnant. She's gone for her test. Likely the urine test is positive, the blood test is positive, and she's getting ready to go for her ultrasound, or maybe she's gone for her ultrasound. Then, pregnancy is a state that you're supposed to still be living your life without any, restrictions, so long as you don't have problems in your lovemaking activities. So when you're pregnant, you can still engage in lovemaking. So imagine a situation where a pregnant woman is pregnant again. It's very rare. So there are 5 basic things you need to know about this condition. This condition is called superfetation. It's as rare as having only about 10 cases throughout the whole world. So there are so many medical doctors that won't come across this condition. It's rare, but it can happen. Now, normally, in a very medically, scientifically backed pregnancy, once you are pregnant, there are a couple of changes that happen in the body of a woman. There are a couple of changes that happen all over the female reproductive system to stop another pregnancy from happening. But in this condition, for some reasons, another pregnancy is superimposed on a previously developing pregnancy. So a woman that was confirmed pregnant will become pregnant the second time. Now, be careful. There are some situations which can also occur, which to an extent might likely be in the same vein with superfetation. That particular one is called superfecundation. I'm not going to use all those big grammar to confuse us today, but it's possible. Now, different case scenarios. If this lady has multiple sexual partners, guess what can happen? She can actually be carrying 2 babies from 2 different fathers. So when you become pregnant and all the hormonal changes that should sustain that pregnancy for some reason. So what are the key changes that will make a woman not to become pregnant naturally, globally? Number 1, the hormone progesterone is a very big key player. When you become pregnant, there are a couple of changes that happen in your body. There are a couple of build-up, more like a preparation. One of the preparations is an increase in the quantity of your progesterone. Progesterone is the pregnancy-maintaining hormone. There are a couple of areas that this progesterone will be produced. What's the role of progesterone? It will begin to go to the womb, to prime the womb, to make sure it has adequate thickness. Once progesterone has worked on the womb together with estrogen, and the endometrium, which is the cover of the womb, is thick enough, pregnancy will thrive. Now, the fact that progesterone is very high, by default, it will stop the release or maturation of any other eggs. So in a normal pregnancy, you are not supposed to ovulate. But in this particular type of rare phenomenon, a woman will go against all odds to release another egg. Now remember, the sperm is a big player in the whole overall scheme of becoming pregnant. Now, in a normal pregnancy, when the progesterone is getting ready and priming the cover of the womb, the cervix will increase the thickness of the cervical mucus, making it very difficult for sperm to come in. This is another protective mechanism that prevents pregnancy from happening. So there are a couple of things we don't expect to see in pregnancy, like bleeding. Anytime you have bleeding in pregnancy is an abnormality. So in this superfetation, for some reasons, a woman becomes pregnant. Now, for some people, once you see a woman carrying more than one baby, you will quickly conclude they are twins. But there are facts we have to imbibe. Number one, this is a rare phenomenon. The possibility that majority of doctors will not experience it in their lifetime is very high. Number two, they are not twins. They are two differently existing pregnancies at the same time. Now, superfetation, it's one of the characteristics that can happen in some mammals. So in lower animals, they can easily have superfetation, but it's not a common phenomenon in pregnancy in humans. So it's a very rare thing, but it can happen. But the point I'm trying to make today, I don't want anybody that probably might have a predisposition to have twins to start freaking out. Oh, is it possible I have superfetation? Oh, this. What about the differences? There might be some discrepancies in your twins. No two twins can be exactly the same. One might be bigger, one might be slimmer, one might be weighing more, one might come before the other. It's okay. When you have twins, you have twins. Remember the two different ways you can have twins. You can release two eggs, and those two eggs can be fertilized by two different sperm, or you can release one egg, one sperm can fertilize the egg, then they will divide and you have identical twins. When you have twins, you have twins. What I'm describing tonight is entirely different from the twinning phenomenon. You have two separate babies in your body developing simultaneously, but they are not twins. The possibility of delivering this baby at the same time is very high. So about 99.9% of time, the babies will be delivered on the same time, because you're likely going to go into labor the same time. Or if we're assisting your delivery, if we're going for CS, we have to open you up and bring out a baby. So these are facts you need to know about this rare medical phenomenon. Why did I preach this? Why did I choose this topic? You see, it's possible to have babies, to have twins or triplets or quadruplets that might not share the same birthday. In California in 2021, when people were getting ready to usher in the new year, a particular family had a showdown. Why? One of the twins got born, got delivered in 2021. By few minutes, the second twin came in 2022. So imagine a situation where the twins are twins, but they are sharing different dates. One was born in 2021, the other one was born in 2022. So in some situations, twins might not be giving birth to exactly the same time. There might be some lag. There might be some little delay here and there, but we need to be careful. I saw people that said, oh, they saw one woman that gave birth to a baby, then after 3 months or 4 months, she came back and had another baby. It's not true. That's not what we're talking about. There are a couple of things that might make another baby to be delayed, especially if you're not being delivered through CS. So remember, the best route, the most protective way to have your twins or multiple pregnancy is through cesarean section. But some people can be allowed to have their baby through the vagina. We monitor you. We make sure that everything is going good. So these are facts you need to know about this rare medical phenomenon. So it's possible. So next time you go out there and you pick an argument, make sure you have a superior opinion on what happens. This is against all odds. This is one of those things that happen in medical practice that up to now we can't explain exactly what might have led to this particular occurrence. So superfetation, a situation of having pregnancy on an already existing pregnancy. So that means you release another egg, which will be fertilized by another sperm. Now, if you have two partners, Mr. KK might be the owner of one baby, and Mr. K4 might be the owner of the other one. Talking about frequency, very, very rare. Just about 10 cases have been recorded all over the world. This is not twins. So understand, this is not a twinning phenomenon. Now, this is just simply two different pregnancies, but different time and existing about the same time. For this particular condition to happen, you have to ovulate while you're pregnant, which is highly, highly, very rare. But as you can see, it can happen. Now, even when you ovulate, the thickness of the cervix, releasing of the fluid will be very difficult for the sperm to come in. Then finally, when the egg is fertilized, the endometrium will not be user-friendly. So these are factors that might likely happen against the expectation. Then you will end up having superfetation. Okay? So that's my presentation. It's a very quick one. Now I'm going to allow the clinic to open. So please feel free to ask your questions in real time. If you have questions, please ask. I can see Tosin. I can see Sada. I can see Diamond B. I can see NG Best, NG Love. Then I can see, okay, just about that. Will you do another live about cryptic pregnancy? Now, I've done a lot of presentation on cryptic pregnancy, and I'm going to tell you this. Yes, the phenomenon of cryptic pregnancy is possible medically. But if the cryptic pregnancy you're referring to is the type they use in deceiving people in a place like Nigeria, then it's fraud. Cryptic pregnancy simply means hidden pregnancy or phantom pregnancy. So normally when you're pregnant, there are a couple of expectations that will tell us, hey, this woman is pregnant. But in cryptic pregnancy, for some reasons, a woman will be pregnant, but she will not know she's pregnant, and she will go as far as second trimester, in some situations, as far as third trimester, before realizing she is pregnant. That's what is called real cryptic pregnancy. So the concept of cryptic pregnancy, sold to so many people out there, is simply fraud. Once a woman is pregnant, there are three things that must happen. There are three ways of knowing that a woman is pregnant. And every singular woman, once you are pregnant, we must confirm these three things. Number one, when we check your urine, we'll see the evidence of the so-called pregnancy hormone, beta HCG, beta human chorionic gonadotropin. This same hormone, when we check your blood, we'll also see an increase every 72 hours in your blood beta human chorionic gonadotropin. Then finally, when you go for your ultrasound, we see evidence that you are pregnant. However, the type of pregnancy that people go out there and they collect their money and they take people's baby and they give them and they tell them, hey, you're pregnant, but don't go to the hospital, that's called fraudulent pregnancy. That's likely what you want me to explain, right? Now, once you are pregnant, the first port of call is your doctor. Anybody that tells you, oh, if you're pregnant, don't see a gynecologist, is a criminal. Don't have anything to do with that person again. Every pregnant woman must go for ultrasound. Now, if you notice, if you go to those places they tell you guys to come for, they will normally tell you, hey, don't go for scan. Why? Because you're not pregnant. They will likely inject your body with a lot of things that will make you mimic pregnancy, but you're not pregnant. That's what happens in cryptic pregnancy. Okay? All right. You're doing great. Okay. Can superfetation lead to a miscarriage of the first pregnancy? Possibly. Now, remember, the outcome of every pregnancy is dependent on so many factors. Some you can control, some you can't control. So we have not seen the literature that correlated miscarriage, abortion related to first existing pregnancy. But miscarriage or abortion can happen anytime. Stillbirth can happen in any pregnancy, especially if the reason why it's happening is from the chromosomes. So if we have any error in cause of the exchange of chromosomes from the mother and the father, and the body rejected the chromosomes, then the body will reject the pregnancy. This is what happens in majority of miscarriages, majority of abortions. And remember the difference between abortion and stillbirth, 20 weeks. So necessarily, we cannot correlate superfetation. That's the second pregnancy that will happen on the first existing pregnancy to increase in possibility of having miscarriage. We don't have such backing literature to support that. Okay? All right. I love that question. Can you ask some questions that defy all odds? I love that question. No, you're in America. Your blood test came back negative. Your ultrasound shows no baby, but you have movement. My sister, I will tell you this in all sincerity. If you're pregnant, you're pregnant. Especially if you're in America. Now, we can dictate your pregnancy as early as first few weeks. You're not even supposed to wait to do your urine test. There are some standard methods that can easily pick your pregnancy. Now, I understand when you genuinely want to become pregnant, then you see that no line, you see that negative pregnancy test, it can crush you. So maybe that's what you're going through. So, my sister, if you were pregnant, your blood, especially, your blood test is superior to the urine test. Your blood test will pick up your pregnancy. So if your blood test was negative and we didn't see any sac or any pole in your ultrasound, my sister, unfortunately, you are not pregnant. What do you need to do? Pick yourself up. The sun will always rise again. So if you're not pregnant in July, you will likely be pregnant in August. If it doesn't happen in August, it's going to happen in September. Don't waste your time hoping you're pregnant, mourning a pregnancy you couldn't achieve, and you miss your opportunity. So what do I mean by that? There are some women that any month they see they are bleeding, they go into depression. Some women might spend 2 months before they come out from that depression, and before you know it, you've lost 2 chances. Remember, you have just 24 hours every month to become pregnant. Once you miss that 24 hours, you start all over again. Why do you have 24 hours to become pregnant every month, which coincides to your cycle? Because the egg, when the egg is released, the lifespan of the egg is about 24 hours. Once that egg is not fertilized, then you start all over again. So don't spend the whole of August crying because you got a negative pregnancy test. Pick yourself up. Once that bleeding stops, keep on making love. Or even if you're bleeding, but you guys prefer to make love during your bleeding, it's 100% okay. There is nothing wrong in it, so long as both of you are infection-free. Okay? Has the older baby delivered? Just like any other method. Remember, the fact they are in close proximity, the possibility that if this lady goes into labor, both babies are going to be delivered is very high. But they are not twins. Now, if we decide to use assisted delivery, then if we induce or augment or go for instrumentation or go for CS, of course, if we open up the baby, we're going to bring both of them out. Okay, so pretty much everything that happens in twins will still be applicable, but technically they are not twins. Okay? All right, Tosi, sometimes you don't have questions, you just show up and you learn. I hope you guys are going to join us in our Facebook almost immediately. Doc, please, is prenatal and pronatal multivitamin the same? Well, it depends on the use of the words. What's prenatal? Pre means before you become pregnant. Now, I've been seeing a lot of people that go by that pronatal vitamin. Maybe it's a generic name. The only thing I'm going to tell you is this. Don't just look at the name. Look at the content. So if you have a good pharmaceutical shop, go there. Possibly seek audience with the pharmacist. When you see the pharmacist, tell the pharmacist, please, I need very reliable prenatal multivitamin. Thankfully, you don't need prescription. You go to the over-the-counter section, check the dates, make sure it's not expired, check the contents, make sure it has adequate quantity of folic acid, 400 to 600 microgram. Then you buy them. You start taking them way early before you become pregnant, because the earlier you take it, the better you're in a better position to make sure that your baby is well protected. Unfortunately, some women won't even know they're pregnant until first trimester is gone and they are just entering second trimester. And the most important period that your prenatal vitamin is needed is within the first 3 months of your pregnancy. Matter of fact, the first month. Okay? All right. How far apart can superfetation be? Just about a week. It's not months. It's like a week or a few days. Very good question. So those stories, those old ladies' stories. Oh, I was pregnant. Then after 2 months, I became pregnant again. Then after 3 months, after 4 months, it doesn't happen that way. So max 1 week. Remember, we've had only 10 cases in the whole world. So that will tell you how rare this condition is. Okay? Can superfetation occur in a woman already pregnant with twins? Can I go easy? We haven't seen this in the literature, but the possibility is there. Remember, some people might have twin pregnancy. They wouldn't even know they have twin pregnancy. So yes, if a woman is carrying twins and another pregnancy comes in, then the woman will by default have 3 babies. So the answer is yes, technically. But we haven't seen such in literature. But it's possible. So if the pregnancy you had Before you have the second pregnancy is multiple pregnancy, and you have the second pregnancy and everything is all good, then you will have 3 babies. But those 3 babies are not going to be triplets. It's important you understand this medically. Typically, without superfetation, what happens to sperm when a woman is already pregnant? I love this question again. Now, you know that sperm is protein, right? I want to give you an assignment. As a woman, pay attention to the semen during lovemaking. Don't make love in the dark. I just want you to pay attention to your partner's semen. Semen is the fluid that comes out from the penis at the peak of sexual intercourse. Pay attention. The maximum number of time you will see the sperm, the semen, like pap, maximum, within 30 seconds, it's already become clear, like catar. Why? It's protein. Once it's exposed to air, it's going to denature. So this, in the same vein, when a baby is developing, your baby is safely in heaven inside the mother's womb. The baby is developing in an amniotic sac. Inside that amniotic sac, you have amniotic fluid. The baby doesn't know what you guys are doing. So the whole sperm, the whole semen that will be poured inside the vagina, majority of them will drop off. Now, the few of them that happens to enter the womb will just go around the womb, swim, and become absorbed as part of waste product and go outside your body. So principally, nothing happens to that sperm. Now, remember that when you're pregnant naturally, the thickness of the cervix, the cervical fluid will be thick, so it might not even allow the sperm to come in. So it's just like if you're passing through toll gates, once the soldiers are about coming, the president is coming, nobody can enter that road again. That's what happens. Or if you're expecting Queen of England, if Queen of England is traveling on the road, nobody will be on the road. That's what happens. So once pregnancy happens, so many changes will happen in the body. So any sperm that is coming in will just be playing outside the arena. The sperm cannot enter the stadium. That's what happens. So sperm is protein. Sperm is easily denatured, easily converted into waste product. That's what happens. So there is no communication, because some men will come and say, hey, doc, my wife is pregnant. I don't want to make love because I don't want to be pouring sperm on the baby's head or whatever. That's nonsense. Your baby doesn't even know what you guys are doing. Baby is doing fine in the amniotic sac and the amniotic fluid. Okay? I love those questions. Please, it's postnatal, not my sister. I've made this clear. What you need to be on the lookout for is the description. So, what do you call it? Okay, so if you're asking about post, let me understand your question before I confuse you. If you're asking about post means after pregnancy. Yes. If you're in Nigeria, your regular common one there is what? The pregnant care, right? If you notice, there are pregnant care they will tell you to take before pregnancy. There are pregnant care they will tell you to take shortly when you're breastfeeding. And there are pregnant care they want you to take after pregnancy. So anything that happens after pregnancy is called postnatal. Natal is the state of becoming pregnant. So prenatal means before pregnancy. Natal means during the period of pregnancy. Post means after. So yes, we can have post and prenatal. Post and prenatal are not the same thing. They are not the same component. The time we want you to take your prenatal vitamin is before, then after is just maintenance. Very important. Okay? All right. We still have about 7 minutes. Do we still have any questions? Remember, if today is the first day of attending this clinic, every Tuesdays we meet about 6:30 p.m. Eastern Time US, 11:30 p.m. Nigerian. So if today is the first day, please make sure you like our group. Make sure you like this video. Make sure you comment. Make sure you share the video and subscribe. When you subscribe, click your notification so that anytime I show up, you will have opportunity to join me. You get free lecture, free education. You know your body better. You begin to be in charge. You take over and you begin to know better, because when you know better, you are better. Okay? All right. Do we still have any questions? Have I provided feedbacks to all your questions? If I have, remember we have a big event in this group. coming up on the 28th. If you miss this, you've missed a lot. We are gonna have a super masterclass, overcoming infertility super masterclass. Super means super. It means you will not live the same. You will come with your infertility, but you will live with a tool that will enable you to become a mother. I cannot promise you what I will not deliver. I'm promising you that on the 28th, we are going to have fun. Registration is still currently ongoing. So if you are interested, make sure you follow the links. Make sure you register, and we'll meet you on the 28th. 9 p.m. Nigerian time. Make sure your partner is in attendance. Now, if you're led in the spirit and you know you've been blessed and you want to sponsor a couple of women who might not be able to attend because of their financial situation, you can also tell admin, hey, please, I want to sponsor this number of women. Please, how can I do that? You can shoot us an email and we can tell you what to do. So that's what's going to happen on the 28th. Okay? The recommended dose for your prenatal is 400 to 600 microgram, not milligram. Milligram is bigger than microgram. Be careful so you don't overdose, okay? All right, guys, do we still have any other questions? Okay, Sada, when you undergo IUI, when can you do pregnancy test? The same 4 weeks, the same 2 weeks. The same 2 weeks, just like in your IVF, 2 weeks, 14 days. Okay? All right. Okay, so if you are not in our Facebook group, can you begin to transition to our Facebook group? Remember, we are everywhere. We are ubiquitous. So we are in Facebook, we are in Twitter, we are in YouTube, we are in Instagram, we have a website, and we are in your families. So anywhere you look for us, you're going to find us because we care, because we want to help you. So guys, begin to transition to our Facebook. We're going to go there to our page, Facebook page. We have group. We have our community page, then we have our page, our main page. So I'm going to be on our main page, but admin will broadcast on all the other outlets. I love you guys. Thank you for coming, and I'll see you guys in our next clinic. So join me in Facebook, and I'll see you guys shortly. Share this video with anyone you know will benefit from this video, and I'll see you guys again on Saturday. Saturday's clinic is 12 p.m. Eastern Time, 5 p.m. Nigerian time. Thank you for coming this evening, and I'll see you guys shortly in our Facebook. Bye-bye for now. God bless.